Access to quality health care shouldn't depend on your zip code. And yet, for too many families across Chicago, that has been the harsh reality. Tonight, we're focusing on an organization working to change that story. Friend Health has built its mission around bringing compassionate, comprehensive, and community-centered healthcare to neighborhoods that have historically been overlooked. From primary care and mental health services to pediatric care, dental care, and support for chronic conditions, Friend Health is committed to meeting people where they are and treating the whole person, not just the illness. And now that mission has expanded with the opening of a brand new Friend Health Center in Back of the Yards, a state-of-the-art facility designed to provide affordable, culturally responsive care in one of Chicago's most diverse and resilient communities. The center represents not just another clinic, but a promise that every Chicagoan deserves the dignity of accessible, high-quality health care close to home. Joining us now to talk about the vision behind the expansion, what it means for families on the south and southwest sides, and how Friend Health is reshaping community wellness across Chicago, is the organization's CEO, Wendy Thompson. Wendy, welcome to the program.
Thank you for having me here this evening.
Let's start with the mission of Friend Health, a trusted provider in Chicago's south and west sides. Tell us about how that has evolved over time in meeting the needs of the community that you serve.
Absolutely. Well, we stay core to our mission. We are here to meet the needs of the underserved. What that means is that we provide healthcare services regardless of an individual's ability to pay, regardless of their insurance status. And we attempt to meet individuals where they are. And meet them and to meet whatever needs they might have. And frankly, those have evolved. What we know now is that the need is greater than it ever has been. In addition to the chronic conditions that we see across the southwest sides of Chicago, we also see an increasing need for mental health supports with substance use disorders, and a host of enabling services from transportation, housing. And so now we're standing in the role of connecting individuals to whatever supports they need to live their healthiest lives.
Yeah, and it's a multi-pronged approach, right? It's not just one area, but in multiple areas, and sometimes having to work on them simultaneously.
Absolutely.
Let's talk about the new investment at Front of the Yards. Why this location, and are there any specific health challenges that you're seeing in this particular neighborhood?
Sure. Well, we have supported and served the Back of the Yards community for well over a decade. And we were excited to become involved with the United Yards Project, one, because it was a community-driven effort where the community spoke up and determined what was needed. And so we viewed that as an opportunity to deepen our commitment. So we view this as a further investment and a long-term commitment to the Back of the Yards community. Going from 5,000 square feet to 15,000 square feet has enabled us to provide a comprehensive health center where we're having where we're able to provide more services in-house and not requiring individuals to have to go elsewhere for services that previously they had to.
Yeah, and as you mentioned, being able to serve greater numbers is meeting the need that continues to increase.
Absolutely.
And you also mentioned transportation, one of the barriers that many communities face, including insurance gaps, as well as a mistrust of the healthcare system. Can you talk to us a little bit about how Friend Health is chipping away at those barriers and meeting people, as you said, where they are?
Sure. In addition to our traditional health services, primary care, mental health, and dental, we have robust care coordination. And so these are individuals who work with patients and the community at large outside of the exam room. We we meet with patients, we better understand what challenges they face, and we have a host of partnerships with organizations in housing, organizations that address needs relative to food insecurity, and also with respect to transportation. And so whatever that particular need is, we help them navigate the system, but additionally now they have another person. And what we find sometimes is that patients call and they want to talk to their care coordinator because they know that that's the person who's going to help them get the service or get the answer that they're seeking, even if they don't know what the question is at that time.
Yeah, and building those relationships, personal relationships, really helps to build trust, to go to the same person over and over again when it has to do with your health care. We started to talk a little bit about the integrated health model, right? A multi-pronged approach in holistically caring for people's health. Tell us about that integrated model with Friend Health. I mentioned primary care, behavioral health, and family services. Why is this whole person approach so critical to the work that you do?
Sure. You know, it's essential because particularly when you're serving individuals who may have been underserved previously, they may come to us for a particular condition or to address a particular issue. And through the process of providing integrative care, we determine that there are more issues, right? So everything from stress that's revealed and our ability to connect them with a behavioral health provider who is in the health center, we're able to help them with brief interventions or, in some cases, connect them to a behavioral health professional for longer-term care. Likewise, we spoke about our care coordination services. We provide those. And we also have a subsidiary, HRDI, that has provided behavioral health services to the community for over 50 years. And with that relationship, we're able to provide everything from 24/7 crisis care to up to and including residential services for individuals who need assistance, residential services for mental health and substance use disorders.
Yeah, there's a short and long game when it comes to healthcare and working with the community, and Friend Health is absolutely leading in that space. Thank you so much, Wendy, for joining us, and welcome to CAN TV.
Yes, thank you.
As you shared, this is your first time here, the first of many.
Wonderful. Thank you so much for having me.
Happy holidays.
Happy holidays.